do understand that many of you are embarking on this journey for the first time, being part of TEAM in 2026. And we want to provide you or show you what a tool can do for you as you are preparing for this and as you are going through that journey at the beginning of next year. As we'd mentioned, what we learned with Hollywood was the importance of having detailed data and access to the analytics at any time to be able to make adjustments, understand where you were at, understand where you need to be successful in this program. Taking a first look, this is a high-level overview of a hospital view. So you're going to see all the bundled payments here, everything from CABG to your major bowel procedures. We want to give you a view of what is going on with your facility for the TEAM program. You will see initially in this column, you're going to quickly see what is your risk-adjusted target price. So this is unique to you. So you understand where you are targeting, where you should be. We're also going to show as cases become live and we're able to get access to the results or to the outcomes of what you were able to achieve, we're going to now see what your delta was from the target. So understand, were you below cost, were you slightly above cost, and how far away from that delta or from that risk-adjusted target price are you? And as we continue to move over, that's where we're going to be able to provide you a total predicted reconciliation, or give you an idea based on the number of cases multiplied by your delta or your average delta from the target price. What does that reconciliation look like? And then finally looking at where are you either ahead or behind of your target price. So in this instance, it's 27% ahead. Now, as we're able to look at all of the bundles throughout this, we're able to give you a predicted reconciliation for this particular year. And that would be based on what has been achieved and where you're going with the current bundles that you're participating in. Give you an overall idea of how far or where are you at compared to the target price. So in this instance, it's 10% ahead of the target price. And then depending on the track, this will be unique to you, but this also gives you an idea of what is your potential earnings if you were able to achieve that 20% cap. For example, if you were in a track where you had that 20% upside or downside for that particular track. So we want to just be very clear, where are you at, what is your potential, and then the details behind every bundle that you were in. Now, we also know that we need to get even more detailed into this. And so now we're able to look at the bundle details. So as we mentioned, we still will have the risk-adjusted price. Where are you at from the target? What is your predicted reconciliation? Now we're going to be able to give you the exact number for your total episode spend. And then we want you to know these two important numbers. What is your index admission? So really DRG based. And what does that non-index portion look like when looking at the overall episode spend? So what is that post-discharge spend looking like? So we know that is where we're going to be spending a lot of time understanding how to manage the post-discharge and keep those costs down as optimally as possible. And two major components of that would be discharge home, so giving you a percentage basis, how many patients are being discharged home, and then also a 30-day readmission. So that gives you a little bit more detail on a bundle level. And then what we find has been extremely important in regards to physician engagement, engaging the correct leadership within the hospital, is also being able to show and provide physician level details. So in this, now we're just looking at one particular bundle. So looking at coronary artery bypass grafts, and we're able to see on a physician by physician level, where do those physicians land in regards to your target price for your institution. So our fictitious Max Planck right here is quite above that target price. And then we have other individuals down here that are quite below the target price. So this gives us an idea of what the clinical staff within your facility is actually doing. We're also able to do, if we want to look at it in more detail, we're able to actually then pull out, so not just a graph comparing to the target price, but really get detailed into what is that particular physician doing and seeing the details of the cost of their cases. So we will dig in just a little bit more because we do have one more view that I think is important, is the physician view. We found that physicians like to look at this just as much as the administrators. They like to understand where they're at, where they stand. Sometimes they even like to really compare themselves to their peers so they know what they can do better or how they can adjust to the rest of the peers within the hospital. So now we have a physician view. We can look at all the physicians, which is easy. Again, this looks very similar to the overall view, but now we can start digging into individual physicians as well and getting an idea of where they stand. So now this is going to be just one physician looking at their cost structure, looking at the number of cases and the bundles that they are participating in. And then we're able to then go down and look at individual cases. So this is within one physician. This is a physician view with one physician and all the individual cases within this bundle and what is going on with those individual patients. So this really gives us that granularity that allows everyone to have that view of what is going on, where do we stand in the program, how do we be successful, and then where do we need to make these adjustments. And this allows us to track how also once those adjustments are decided upon, we can track how those adjustments throughout the year are actually affecting the price and and getting us closer or further away from the target price that has been set for the hospital. So we find this extremely beneficial to be able to start very high level and dig all the way down to an individual patient and procedure view.
And the other thing too, part I'll share here as well, and where this has been really helpful for health systems, especially if systems and hospitals have a gain share in place. So of course, this can be incredibly motivating as you begin to do this type of work, and so that surgeons can see what is my contribution? What is not only what is my performance relative to my peers, but they can see their financial contribution, how much revenue that they're able to generate, in addition, of course, to their regular fee for service. But then this is just kind of an additional source of revenue when they're looking at doing bundled payments. So having that detail when they can look at that by case has been really impactful for our customers that are doing this type of work.
And I think that's a great point. And I will refer back, and we can send this asset. The follow-on to the Hollywood Presbyterian case study written up in the Harvard Business Review was just that. How to engage your physicians in some sort of financial or gain share program. This was written by our CEO, Derek Haas. We will definitely share that because I think it is extremely important, as I mentioned, to have full buy-in from the physicians as we move throughout this program. The only thing I wanted to finalize on as part of our tool, we also have a PAC tool, which allows you to be very prescriptive on your location and where there are options to place your patients post-discharge. Obviously, as much as we can do a discharge to home is optimal, but we want to provide a tool to where you can see facility by facility, what is the average number or length of stay for a particular procedure at that facility. We can even give you a predicted or an expected post-acute care cost at that facility, and then your expected readmission from that facility. So it is very unique to your geography. We want to give you the tools and empower you to be able to make these decisions as you're going throughout this program to be as efficient and choose the facilities that are going to be best for you and most importantly, best for the patient.